And you ask, we answer your vaccine questions here on Fox 61. We're taking your concerns and your inquiries to the experts amid the vaccine rollout.
This morning, we're once again joined by Dr. Syed Hussain from Trinity Health of New England. Doctor, thanks as always for joining us. Our first question coming from Carl Olson. He's asking people who have those underlying medical conditions, will Connecticut require a doctor's note or other evidence of any kind of underlying medical condition as other states do?
Morning. Thank you for having me. So, Carl, now that the state of Connecticut has expanded eligibility to 16 and above, those individuals that fall between the ages of 16 and 44 and have one of the 5 high-risk medical conditions, namely Down syndrome, sickle cell disease, end-stage renal disease on hemodialysis, active cancer treatment, as well as solid organ transplant recipient, then those individuals will get a special note from Trinity Health of New England if you're falling within our healthcare system to be able to schedule an appointment. Trinity Health of New England at its vaccine clinics has reserved spots. I believe other healthcare systems may be doing the same thing. So we do not require a doctor's note to set up an appointment. But if you need additional information, please go to trinityhealthofany.org or talk to your physician to see how you can get prioritized now that eligibility has expanded to 16 and above.
Well, doctor, we got a really good question from Joan. It's actually one that we've been talking about here in the news studio. Here, Joan wants to know, once you've had both shots with the Moderna vaccine, if and when a booster is needed, do you have to stay with that vendor or could you switch over to Pfizer? Will there ever be a time when you can safely switch?
So currently, in our current state, the CDC only in exceptional circumstances, if you've received a first dose of Pfizer and for some reason, some extenuating circumstances that prevent you from getting a second Pfizer dose, only in those circumstances can you get a second dose, which is Moderna. However, it remains to be seen what happens with the booster doses. There are a lot of variables here that we don't have answers to, including is there a variant that gains ground across this country that can dodge the vaccine that are currently approved? We don't want that. That's the worst case scenario. Both Pfizer and Moderna are currently working on what a booster dose would look like, but that will again depend on whether there is a virus in the country that is able to dodge the currently licensed vaccines.
All right, I know this next question is one you've answered before, but of course it's an important one and we want to get the information out there. Savandra Lopez wondering if vaccines are safe for people with heart disease, diabetes, high blood pressure.
So the answer is yes. The short answer is yes. We know based on data from the clinical studies that Pfizer, Moderna, and Johnson & Johnson conducted that they included individuals with medical comorbidities, including high blood pressure, diabetes, obesity, et cetera. And we now have real world data, in fact, millions of doses, over 170 million doses that have now been administered in this country alone. And especially, remember, we started off this vaccine rollout with individuals that were 75 and above, and those individuals tend to have medical comorbidities. So the answer is yes, it's safe. And these are very effective vaccines.
Oh, doctor, we know you have a Vaxathon coming up. This is very exciting. It's going to be a 24-hour period where you at Trinity Health, doctors, health officials are trying to get as many people vaccinated in one day. How is that going to work? How can people sign up? Because so many people are right now, they're struggling to get an appointment.
That's right. And Trinity Health of New England is constantly adding slots. So if you go to our website and if you don't find an appointment, please check again because we're adding slots as supply becomes more and more available. We're very excited about the 24-hour Vaxathon that takes place next week. April 9th, 5 p.m. it starts to April 10th, Saturday, 5 p.m. And we seek to vaccinate thousands of individuals and we're looking forward to it.
Yeah, we're looking forward to seeing the results of that. Dr. Syed Hussain from Trinity Health of New England, as always, thanks for your time.
Thank you.
And for you at home, we're going to keep working to answer the questions that you have. You have concerns, you have questions, send them to us. We have answered a lot of them already. You can check them all out on our website. Head over there. It's fox61.com, and you can click on You Ask, We Answer. It's a blue tab right at the top of the page. And again, if you have any questions, send it to us. Email us at share61@fox61.com. Another way you can get them to us, text us, 860-527-6161.